Approximately 7 million Americans suffer from chronic open sores that become seriously infected and in some cases require amputation. Limb salvage is a type of surgery primarily performed in order to avoid amputation. As we learned from Dr. Christian Ochoa at Valley Presbyterian Hospital in the San Fernando Valley.
The techniques and learning how to do bypasses really came to fruition in the 60s and 70s. And so a lot of what we started to do is begin to save limbs by doing surgical bypasses, either through an open operation. Now in the last 10 years, 15 years, we've been doing a lot of endovascular treatments, minimally invasive operations where all it takes is a needle stick in the artery, some x-rays, some dye, a balloon, a stent, and now we can actually do a lot more and save limbs at the same time. Primary care physicians, at least from my standpoint, are the gatekeepers of care. And so they are the ones that are really looking at the patient through a whole holistic approach and seeing if they have gangrene or if they're diabetics. A lot of our patients are diabetics. And so they will be the ones that would see those patients, and then we'd get those as referrals. And it's a real full team approach from the nursing, from the podiatrists, and from the vascular surgeons, as well as from all the other disciplines that actually take care of the patients, the diabetic physicians, the renal doctors, and the cardiologists. So it's a full spectrum. And we try not to just look at the isolated lesion as one problem. It's a global problem. When a patient does come into our clinic, they see the nurse right away. They see the podiatrist and the vascular surgeon at the same time. Depending on how severe their wound is, we get them admitted that same day and may even perform an operation that same evening. One of the sayings that we have is time is tissue. We want to try to save as much of the limb because the longer you wait, the longer the gangrene is going to set in and the worse outcome you may have, and you may not be able to salvage as much. That's the importance of the limb salvage, is really getting in there, trying to save that limb so the quality of life of not only the patient but of the family itself goes up. So that's our goal.
Dr. Ochoa shares a patient story.
We've been fortunate enough to get patients from all over the world. And we actually had a gentleman from the Middle East who came, who had been operated on in Europe many times and had been told that amputation's the only way to go. And he didn't take that. So he was able to find our center, got over here, we did an operation. He essentially had pretty extensive gangrene and tissue loss of his foot. And most other facilities said, no, you have to have a below knee amputation. So we evaluated him, did the whole team approach at the Amputation Prevention Center, saw everybody, saw the podiatrist, saw myself. Next day, had an angiogram, pretty extensive disease. Luckily, he had vein conduit, so we could do a surgical bypass. Did a surgical bypass. Podiatrist at the same time debrided and did whatever they needed to do for the foot. And then probably within the month after recuperating from that operation, he was able to start walking again. These patients should not take no for an answer. This is not a disease where you can just have one opinion and say, that's what you have to go to. They have to take matters of their own hands. They have to go out there, seek that second, third opinion sometimes, and wait for someone to say, yes, okay, you absolutely don't have any way of improving or saving your limb. But at our center, we hope that we're the last decision making and that we can hopefully save the limb.